Have you just been diagnosed with cancer? And are you feeling overwhelmed, lost, scared, or confused? You are not alone. Most individuals newly diagnosed with cancer feel this way. So it's important for you, no matter how you might be feeling, to know that that's pretty common, unfortunately. Having difficulty falling asleep because of worry, feeling more irritable, isolating or withdrawing from others, having a hard time getting things done at work or at home. All of these are signs that you may be having some difficulty adjusting to your cancer diagnosis. Now, for most cancer patients, this distress tends to decrease as treatment progresses over time. But for about 25% of cancer patients, this distress continues and can unfortunately get worse over time. So it's really important to know the warning signs and get support early on in treatment to figure out how to cope effectively and avoid long-lasting negative effects on your mood and quality of life. So today, I'm going to give you 3 tips on managing these overwhelmed feelings when first diagnosed with cancer. So first, acknowledge that this is a scary and uncertain process and consider this year a bit of a wash. Cancer treatment is long, and even amongst patients diagnosed at early stages, having tests done, waiting for results, undergoing surgery, chemotherapy, or radiation, all of that takes time to complete as well as recover from. So no matter what stage patients are diagnosed at, I always encourage them to just prepare their expectations for the upcoming year, to appreciate the length of the interruption cancer causes, while also allowing space for some ups and downs. Secondly, create time and space in your schedule to allow you to process whatever feelings you may have on your own. It's natural to feel like you're on an emotional roller coaster once you're diagnosed with cancer. And if this is your first ride, schedule time for you to express yourself and feel however you want to feel without any judgment. Anger, sadness, fear, these are all pretty common natural feelings after being diagnosed. So it's important to give yourself time to feel these feelings on your own and not having to worry about how others might react. So try sitting in the park for half an hour, or maybe sitting in your car an extra 10 minutes before you go inside after work. Whatever you need to make time to process and feel your feelings about cancer. Thirdly, identify your support team. Going through cancer is tough, and a healthy support system is critical to getting through treatment. Identify who in your network you can go to for what types of support. So, for example, who do you want to listen to you, to just listen and not give advice? Who can join you for doctor's appointments and help you ask questions? And then who can help you with household chores when you're feeling too tired? It's important to identify who can help you with what so that you get what you need and your team knows how they best can help you. So these are just a few tips for how to cope once diagnosed. There are numerous other strategies that have been proven to help patients manage the stress and make treatment decisions. So take your time learning these, and if you need more individual support, all you have to do is ask. So if you would like more support or information on how to cope with your diagnosis or other treatment side effects, feel free to have a look at my website, or if you need more individualized support, schedule a session with me. You can do that immediately online. Go to www.psychotherapywithoutborders.com. Being diagnosed with cancer can be overwhelming. And you, only you, can choose how you want to get through this and live a full life after cancer.